If you're enjoying this Med Prep to Go Step 1 podcast, you can now get the content along with the content of the Crush Step 1 podcast ad-free in one bundle. Just go to medprep2go.com and find our new subscription podcast called Med Prep to Go Step 1 Bundle.
When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite. Obey your thirst.
This episode is brought to you by Indeed. You're ready to move your business forward, but first, you need to find the right team. Start your search with Indeed-sponsored jobs. It can help you reach qualified candidates fast, ensuring your listing is the first one they see. According to Indeed data, sponsored jobs are 90% more likely to report a hire than non-sponsored jobs. See the results for yourself. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
Every Who down in Who Newville liked the holidays a ton, but where to get great prices on gifts, they had no idea. None. They searched and they searched for great gifts under $25. Gifts for spouses and friends and even their toddlers. When suddenly one Who shouted, Walmart has what you want, knowing they have Lego, Tree Hut, and low prices to flaunt. So they enjoy the holiday season as Who's often do. Cheering and shouting, Walmart has incredible gifts. Who knew? Find gifts they'll love under $25 at Walmart.
This is Dr. Ted O'Connell with the Med Prep to Go podcast. Today we'll be reviewing 3 pathology questions. Just a reminder, you can also find these questions and many more on our website at medprep2go.com. If you have feedback for us or want to get involved in this project, please contact me at ted.medprep2go@gmail.com, or you can contact me through our website as well. If you like what we're doing, let your friends know about us, give us a review. All of that will help a lot. If you want to learn more about me and my books and projects, you can find that at tedxoconnell.com. All right, let's get started with the questions. A 60-year-old man presents to the physician's office complaining of waking up during the night to urinate, urinary hesitancy, and a weak urinary stream for the past 6 months. Physical examination reveals a firm and enlarged but intact median sulcus of the prostate. Laboratory tests reveal normal urinalysis, normal renal function, and a normal prostate-specific antigen, or PSA. Which of the following areas of the prostate is most likely affected in the disease process that is suspected to occur? A, central periurethral zone. B, median lobe of the prostate. C, posterior lobe of the prostate. D, quadrate lobe of the prostate. Or E, transitional periurethral zone. The correct answer is A, central periurethral zone. This patient is suffering from benign prostatic hyperplasia, or BPH. The prevalence of BPH increases with age, such that 70% of men who are 60 years or older will have BPH, and 80% of men who are 80 years or older will have BPH. BPH can present with urinary frequency, urgency, nocturia, incontinence, weak urinary stream, straining to void, hesitancy, and terminal dribbling. The digital rectal exam, or DRE, typically reveals a firm, smooth, intact median sulcus of the prostate gland. BPH usually affects the central periurethral zone of the prostate. The key learning point here in this question is that BPH typically affects the central periurethral zone of the prostate and can present with urinary frequency, urgency, nocturia, incontinence, weak urinary stream, straining to void, hesitancy, and terminal dribbling. Question 2. A 75-year-old man with a history of hypertension and type 2 diabetes presents to the emergency department with a complaint of dyspnea and shortness of breath after exercise for the past few weeks. The patient notes that he generally stays active and does not live a sedentary lifestyle. He denies nausea, vomiting, fevers, and chills. He drinks alcohol socially and smokes 3 to 4 cigarettes daily. Current medications include amlodipine and metformin. Vital signs in the emergency department are temperature 36 degrees Celsius or 98.6 degrees Fahrenheit, blood pressure 134/84, pulse 75 beats per minute, and respirations 17 per minute. Body mass index, or BMI, is 30 kilograms per square meter. Physical examination reveals a high-pitched, crescendo, decrescendo, mid-systolic ejection murmur at the right sternal border. All lung fields are clear to auscultation. Laboratory values are within normal limits. Which of the following most reflects increased severity of this patient's condition? A continuous machine-like murmur. B, a long, late peaking murmur. C, presence of an S4 heart sound. D, short, early peaking murmur. Or E, a short time from S2 to the opening snap. The correct answer is B, a long, late peaking murmur. This patient has aortic stenosis and is presenting with complaints secondary to this valvular insufficiency. When aortic stenosis is mild, the murmur will peak in mid-systole. As the disease becomes more severe, more time is needed to complete systole, and the aortic valve closure becomes delayed. Therefore, the murmur peaks later in systole. Answer choice A, a continuous machine-like murmur, is incorrect. A continuous machine-like murmur is present in patent ductus arteriosus, not aortic stenosis. Answer choice C, presence of S4, is incorrect. Presence of an S4 heart sound is usually consistent with left ventricular hypertrophy and does not present in aortic stenosis. Answer choice D, short, early peaking murmur, is incorrect. Increased severity of aortic stenosis is indicated by a long, late peaking murmur, not a short, early peaking one. Answer choice E, short time from S2 to opening snap, is incorrect. A short time from S2 to opening snap is indicative of increased disease severity in mitral stenosis. The key learning point for this question: aortic stenosis presents with a high-pitched, crescendo, decrescendo ejection murmur heard best at the right sternal border. When aortic stenosis is mild, the murmur will peak in mid-systole. As the disease becomes more severe, more time is needed to complete systole, and aortic valve closure becomes delayed, peaking later in systole.
Hey, this is Bill Simmons from the Bill Simmons Podcast, here to tell you that Michelob Ultra, the official beer partner of the NBA, is bringing NBA fans closer than ever this season with chances to win great prizes, including courtside tickets. Enter now at michelobultra.com/courtside. Michelob Ultra Courtside 25 to 26. No purchase necessary. Open to U.S. residents 21 plus. Begins on October 1st, 2025 and ends on June 30th, 2026. Multiple entry periods. See official rules at michelobultra.com/courtside for free entry deadlines, prizes, and details.
Question 3. A 30-year-old man comes into the clinic with a 2-week history of fever, cough, and shortness of breath. He reports several episodes of bloody sputum. He is a non-smoker and lives a healthy lifestyle. Past medical history is unremarkable, and he does not take any prescription medications. Vital signs are within normal limits. Physical examination shows a crescendo, decrescendo, mid-systolic ejection murmur, loudest in the right upper sternal border. Transesophageal echocardiogram, or TEE, shows a tricuspid valve vegetation. Blood cultures show gram-positive cocci in clusters. Which of the following most likely predisposed this patient to his current infection? A, childhood asthma, B, endoscopy, C, intravenous drug use, D, pharyngeal infection, or E, recurrent sinusitis? The correct answer is C, intravenous drug use. The patient has bacterial endocarditis caused by Staphylococcus epidermidis, a coagulase negative and catalase positive cocci. Intravenous drug use is a known risk factor in the cause of right-sided infective endocarditis, as it introduces pathogens from the skin surface directly into the venous circulation. The bloody sputum is caused by septic emboli, which break off and enter the pulmonary circulation, resulting in pulmonary complications. Answer choice A, childhood asthma, is incorrect. Childhood asthma would not result in the cardiac findings seen in this patient. Answer choice B, endoscopy, is incorrect. Endoscopy would not create the cardiac findings seen in this patient. Answer choice D, pharyngeal infection, is incorrect. Pharyngeal infection with Streptococcus pyogenes can predispose an individual to rheumatic fever and rheumatic heart disease, which typically affects the mitral and aortic valves. Answer choice E, recurrent sinusitis, is incorrect. Recurrent sinusitis would not predispose to the cardiac findings seen in this patient. The key learning point in this question: intravenous drug use predisposes to right-sided infective endocarditis. All right, so that's it for this episode, but don't forget to check out our other episodes that you can find wherever you get your podcasts, as well as the many questions that we have at medprep2go.com. And if you want to find some of the core content found in this question, please check out Crush Step 1, either in book or podcast form. And we'll see you at the next episode.
Hi, everyone. This is Ted O'Connell. I just want to let you know that we have launched a Step 2 QBank podcast, very similar to our Step 1 QBank podcast. Each episode will have 3 questions so that you can study on the go. We are actively recording these and plan to release a new episode every 2 weeks. We're also launching a premium podcast bundle that will include ad-free access to USMLE Step 2 Secrets podcast, as well as early and ad-free access to all of our episodes from the Step 2 QBank podcast. So please go over to our website at medprep2go.com and check these out, or you can access them wherever you get your podcasts. Thanks so much.